Welcome everybody to the fifth of the ESCoE COVID-19 webinars. And this is a series of seminars in which we're discussing issues that arise for economic measurement with the pandemic. And today we're very pleased to have with us Professor Vasco Carvalho from the University of Cambridge. Vasco is also the director of the Cambridge INET Institute and a fellow of the Turing Institute and the CEPR. So he will talk about his work using high frequency and granular transaction data and what we can learn from these data about the economic effects of the pandemic. So Vasco will talk for about 40 minutes. We'll then have 15 or 20 minutes for questions after his talk. And if you have a question, please use the Q&A facility, which is at the bottom of your screen. You can use that to type in a question. If you're then invited to speak, you'll need to unmute your microphone. And I would be very grateful if you could then, before you ask your question, mention your name and also your affiliation. Please also note that this seminar is being recorded. And I think that's it from me for now. Vasco, over to you.
Hi, everyone. Hope you're keeping safe. Thanks a lot, Rebecca, for the invitation. I hope everyone can hear me and see me or not, Rob. So this is a paper on real-time transaction data and being done in real time. So there's been a very big update within the last 48 hours. I believe ESCoE will share the link to the latest version of the paper. This is joint work with Stephen Hansen and Sevi Mora at Imperial and Edinburgh and a team of researchers at Bbva Research. So I think I'm talking here to preaching to the choir, but as you know, accurate and real-time information is of use to better inform private actions and for taking public policy choices. Yet, compilation of these key economic statistics that we need to make this to obtain information and do these choices is a very slow and costly process. National accounts have a yearly frequency, distributional accounts and censuses sometimes even lower than that. This scarcity of economic data is perplexing in a world that is awash with what has been called naturally occurring data. One version of that would be data held by commercial banks. So everyday transactions that you and I do and that get logged into large-scale information systems. These are cheap in the sense that the fixed costs have been borne by private institutions, available across countries, in particular developing countries where building up national census and national accounts might be very costly. They are very plentiful in the sense that they're very large data sets that you can do different cuts on, and they are available in real time. And as we've seen throughout the COVID crisis, they're likely to assume an increasingly prominent role in both research and policy, precisely because of their value with respect to available official statistics. So in this project, we are working with a very large card transaction data set from Bbva, which is the second largest bank in Spain. And taking a step back, what are the research questions we want to approach here? We want to think about what are the pitfalls and opportunities brought about by this deluge of transaction data, right? So we would like to think about, in particular, of three dimensions that this data set might offer and might be valuable to researchers and policymakers. The first being considering transaction data just as a high frequency consumption proxy. The second being transaction data as a granular, also high frequency household consumption survey. And the third being the dimension of transaction data as a real-time mobility proxy. Just in terms of preview of some take-home points on how we think about the strengths and weaknesses of this data under these three dimensions, we're going to find that transaction data as a high-frequency consumption proxy displays substantially more volatility than what you can think of as national accounts counterparts. But once you take that excess volatility into account, they are very high quality as a coincidence indicator of consumption, of aggregate consumption. Now, the thing is, once you have aggregate consumption, this data is usually geotagged. So you can also go very granular in space and produce subnational high frequency consumption proxies, which are typically unavailable in official data. As a consumption survey, it is important to keep in mind that only a subset of expenditure is really card-based. There's a lot of automatic bank transfers that do not show up in our data set, so account-to-account transactions. But when we do match for the expenditure shares that we are able to match, is about half of the expenditure, the correlation between official consumption surveys and consumption shares as borne by transaction data is very high. Finally, this crisis has brought about this, we're awash in mobility data from Google Mobility, Apple, for example. But in many countries, this data set is not granular enough to help, say, authorities looking at the epidemiological consequences of mobility patterns. And we're going to show you that this is possible to do with transaction data. So those are the big picture questions. We're going to take COVID-19 as a proof of concept that you can use transaction data along these three dimensions and be informative to form a narrative of what has gone on in the past 3 or 4 months. So we're going to be able to do some cross-country analysis because Bbva is a large international bank with national affiliates worldwide. And we're going to find, not surprisingly, larger abrupt declines and in expenditure, something that looks like V-shaped recoveries. And we're going to spend quite a bit of time talking about a particular aspect when we zoom into Spain, in Spain's experience, and about the gradual easing of lockdown. So instead of having some kind of 0-1 analysis of the cost of lockdown, we're going to be able to kind of explore the intensive margin of lockdown as different Spanish provinces are easing in different amounts over time. We're also going to be able to describe consumption patterns accurately, and the summary of that is that this is really a reallocation crisis. There's a large reallocation of consumption, and in particular, if you look at average consumption bundle during the crisis, it looks like the consumption bundle of a poor person in normal times. And intimately related to this is the fact that rich groups experienced larger expenditure declines. Finally, we're going to look at transaction data as a real-time proxy for mobility during the COVID-19 crisis, and we are going to document both the validity of that and document differential mobility patterns across income groups. Essentially, the poor continue to work throughout the crisis, and we're going to try to argue and show to you that this has differential effects on disease burden. All right, so the roadmap, this is a longish paper right now. So I'm going to go into a very brief data overview and then approach the data along these 3 broad categories that we've set out in the introduction. And then within each of these sections, I will do some validation and an application to COVID. So regarding data description, our main data, as I said, comes from Bbva card transactions. Right? For most of the paper, we are dealing with data for Spain alone, with very granular data for Spain, where we can do a number of cuts. What is this data? This data, you should think about it as a join between the universe of transactions by Bbva issued credit and debit cards. So we see the Bbva clients and their credit and debit card transactions, plus the universe of transaction at the Bbva point of sales network. So when you swipe a card in some machine that is logged into the system, in particular if that machine is operated by Bbva. We're going to have data we're going to build up from individual transactions spanning the period between the January 1st of last year, 2019, till about 2 weeks ago. And for most of the paper, we're going to be aggregating these transactions at a daily frequency. Now, not only this data set is large. For Spain alone, it covers about 2.1 billion transactions, 2.2 million point of sales. But it carries with it useful information in the sense that each transaction is tagged. It's tagged by the geolocation of where the transaction took place. It's tagged by the sector of expenditure or categories of expenditure that can be pretty narrow. And we also have online, offline information, which for this talk, I am not gonna talk much about it. For some of our talk, we're gonna focus in on a subsample of the Spanish data, which is the Bbva cardholders. So we're gonna essentially purge out from the data set purchases that we see at Bbva point of sales by clients of other banks. So for the Bbva cardholder subsample, we're talking about 6 million cardholders. And for you to get a sense, you should think about this as a 15% survey of the adult population in Spain. Right? For those, we observe, and we're going to explore information on their home postal code, so their place of residence, and we observe their postal code, their age into bins, and education. And in the paper, you'll see that the age and education structure of this subsample matches well that of adult population in Spain. Perhaps we oversample slightly middle-aged, but overall we're pretty happy with how this correlates with the population at large. For one exercise, we're going to be able to source international data from Bbva affiliates worldwide. It is a little bit of an idiosyncratic sample, the one we have access to. Bbva is present in many other countries, but these have automated feed into the bank central transaction database. And so we're going to get data from Argentina, Colombia, Peru, Mexico. For some states that are going to be in the southern region of the US, we're going to call them southern US states, and Turkey. And this data, we have less detail. I am only going to show you aggregates of this data. So total expenditure time series for a total of 3.8 billion transactions worldwide. So when we put that together with Spain, that's about 6 billion transactions. Right. So what do we do with this? So the first thing is essentially trying to validate these time series that we get out of this data. And then once we validate where we can, because obviously a lot of this data cannot be matched precisely because there are no official series at such granular or definitions of space or commodities or high frequency. But after we validate where we can, we're going to do an application of tracking the currencies in real time. So the first thing we're going to look at is the correlation between the time series of this Bbva expenditure data and national accounts non-durable consumption. What we have here is not our main data set. It's a quarterly historical series made available by Bbva to us. And this covers the period from Q1 2016 to Q4 2019, so pre-crisis, obviously. And to deal with basic issues of seasonality at the quarterly series, we are focusing here on year-on-year quarterly growth. So this is take aggregate card expenditures in Spain, that is a time series, form quarterly growth year-on-year. So what is the growth between, say, first quarter 2019 and first quarter 2018? What is it that we see? We see two first order comments on this validation exercise. First, the bank expenditure or the bank card series for Spain is quite a bit more volatile than the national accounts non-durable consumption. So you can think about a simple concept of an elasticity. So growth rates of expenditure on growth rates of official national accounts non-durable consumption, and that gives you an elasticity of about 0.4. So Big picture order of magnitude, every time consumption expenditure moves 2%, national accounts, non-durable consumption moves 1%. There are reasons that we are still exploring of why this volatility may come about. One big reason is that some stable items in the consumption basket are not covered by card payments. So if you think about utility bills, rent payments, imputed rent for those that own houses, private schools, there's a number of expenditure items that are not paid by card, and therefore they do not show up in our database. Now, these are not only non-negligible, but they're also very stable. They are typically, there's a selection bias into what you transfer regularly in the bank, precisely because these are stable expenditure patterns over time. So our card data will be tilted towards more volatile items of consumption. There's a second reason for this, which is the fact that there is extensive margin action in our data set, right? There is entry and exit of cards, points of sale, and customers into the Bbva. And throughout this period, the Bbva is itself expanding over time and over space. This notwithstanding, if you take the Bbva series and you rescale it by the elasticity I've just discussed, what you get is the graph on the left-hand side. So what you get is what seems to be a very good proxy for national accounts non-durable consumption at the quarterly series. The correlation of that, obviously, irrespective of rescaling or not, is a very high 0.87. And if you focus on the period after, starting 2017 rather than 16, this goes up to the high 90%. I am not going to spend too much time on this, but we also can go from the macro to the micro and look at consumption in narrowly defined categories. And here this is actually one of the few retail indices that is available from official account at the monthly level. And we obtain basically the same properties as above. So a more volatile expenditure series, but again, a very high correlation when and visually very striking when rescaled by this elasticity. So both at the macro and at the micro, at the aggregate national consumption and at the gas sale retail, these correlations are very high, lending some confidence that you can use this series as a high frequency consumption proxy. By the way, I should say that all data is nominal, and that's a proviso that applies throughout. Now, once you've validated this in the dynamics, you can try, as I told you before, one cool thing about this data is that you can go at very granular levels, and in particular granular levels across space. And this is very cool, but at the same time, it starts being the case that you are moving into areas where national accounts are simply not available at a reasonable dynamic frequency. So what we can do is validate the cross-section of these series. So Spain is, for example, divided in 52 provinces. So the left-hand side plots the Bbva expenditure across these provinces with national account annual GDP for these provinces, right? So we are basically taking a correlation on the cross-section of expenditure versus the cross-section of income, which is available. For example, we do not know of provincial level consumption theories, not even cross-sectionally, let alone forming a panel. Again, because we observe very detailed geotagged information, we can go from provinces to zip codes or postal codes in Spain. And here we're going to look at a subsample of this, which is postal codes within Madrid, of which there are about, I forget now, but something like high 200s, almost 300 postal codes. And again, there are cross-sectional measures of income per capita within Madrid at the postal code level. We can build that up from tax returns, actually, at the zip code level. And again, the correlation is a very high 0.92. So in the cross-section, which is where we can check, subnational aggregates also seem to be validated, or at least comparing income and expenditure, where you would expect a high positive correlation that is borne out by data. given these observations, we switched to using this high frequency consumption proxy to characterize two things about two aspects of the COVID-19 crisis. One, not surprisingly, this is a global crisis. So what we've done here is we went back to this international data and took each of the national time series available to us, aggregated with the proper GDP weights. For example, for the US states, we take the weight of those US states, which are Arizona, Texas, and Alabama. And we take the weights of those states in world GDP, right? So we do a GDP weighted aggregate of national series. And then just to make sure we all know what's going on, we do the following. We have essentially daily indices of aggregate expenditure. It's an index. So what are we going to do? We're going to do year-on-year daily growth. And because, and then we are going to express it as in differences, percentage point differences from the pre-COVID period. Right? So this is basically telling you that in late March, early April, the world saw a 50 percentage point decline of expenditure growth when compared to the pre-COVID growth patterns. The second observation that comes from this series is that at the world level, at the global level, and here we are talking about 8% of world GDP, we see a V-ish type recovery, such that by late June, the series is 12 percentage points below the global pre-COVID average, right? Now, perhaps more interestingly, when you look into the countries that compose our index, you find substantial cross-country heterogeneity. There's a lot of series here. They're all plotted in the same way that I told you, year-on-year daily growth, normalized by the pre-COVID average, and this is why they're all centered at 0 here. And what do we observe? We observe in late March some countries that are worst hit in terms of expenditure growth, and that's Peru, Spain, and Argentina. And we also observe, perhaps not surprisingly, if you've been paying attention to discussions worldwide on policy with respect to COVID, that both US and Mexico were initially facing much milder recessions. Okay? And here, to remind everyone, I'm talking about Southern US. By late June, this is a little bit scrambled in the sense that Mexico has, for example, stagnated. Spain is recovering fast. And the bottom countries are now Peru, Argentina, and Colombia. So Southern America seems to be worst affected by late June. And as a preview of what we're going to be looking at, this is of course very, we know what happened during this period. There was a wide decrease in interactions, market interactions. They would be based, so what are these market interactions? They basically going out to purchase stuff or going out to work. So what is the converse time is the time you spent at home, and I'm sure you've seen this. This comes from Google Mobility Indices and tells you what is the growth in time spent at home, right? So it's basically a time use survey. And you find very large social distancing as measured by growth in time spent at home. And what if you start looking into this series, what you find is a very high correlation between how much the inhabitants of a given country stay at home or increase their amount of time spent at home and the decline in expenditure. And the pooled correlation is 0.8 on that. You can also actually do, source series of daily disease incidents and do this same correlation, and the correlation is weaker. Now, these are just broad cross-country correlations. So what we're going to switch to try and understand a little bit more of the effect of lockdown on expenditure is we're going to zoom into Spain. So we're going to go from the world to a country, and then within Spain, we're going to go and look at cross-province variation over time. Before we go there, let me just tell you what happened in Spain from March onwards. So again, you see the same series. So we've normalized by the pre-March, that should say 8th, I believe, pre-March 8th mean growth. This is now the total aggregate expenditure in Spain, year-on-year growth normalized by pre-COVID. So as we saw in the cross-country graph, there is a large decline in aggregate total expenditure in Spain, and we have basically a decline of 60 to 70 percentage points upon lockdown, which was imposed nationally on the March 15th. Other things of interest: the week before the lockdown, there is apparently a stocking up behavior on part of households. You may remember the toilet paper, scrambling for toilet paper in the weeks, in the days ahead, and this is showing up here in terms of a consumption boom just before the lockdown, ahead of the lockdown. You see a stable, low growth of expenditure in year throughout the lockdown period, and then Spain starts easing. The first date of interest is May 4th, when there is a national easing. And that easing is very slight. It basically means you can start going out and interacting with some small businesses under very tight constraints, tighter than currently those in the UK. But that is what the Spaniards called phase 0. It's basically a path of normalization that is then followed by a number of phases. So for example, in green, you have phase 1. And we're going to go over these phases a little bit. And then there's a phase 2, there's a phase 3, and there's actually a phase 4 that we're not going to cover because we don't have enough data. We only have a few dates for phase 4. But what is clear is as lockdown is eased throughout Spain, there is a swift recovery such that by the end of June, we are almost at pre-COVID levels. Okay. Now, what we're going to explore is that this easing of lockdown was not uniform across provinces. So phase 0 was, as I told you, but then advancing into further easing status was done on a province by province cases. So what do I have here? On the left, I have that first date, May 11th, which is phase 1 easing. What is phase 1 easing is basically reopening small and medium retail and some outdoor restaurants under tight capacity restrictions. And what you can do is the following: get the provinces that switched into phase 1, that eased on May 11th, versus the provinces that did not, that remained under the tighter lockdown of phase 0. And what we're plotting here is average year-on-year growth of expenditure and comparing switching provinces that are easing versus provinces that are not easing. So this is basically raw data. We are taking day of the week effects out here, but in the raw data, the same pattern is true. And what you observe is a large increase in daily year-on-year expenditure upon easing, phase 1. Now you can go over the different phases and you find the same for phase 2. What was phase 2? Was May 25th. It was the reopening of larger retail and malls, but still under capacity restrictions that were a little bit eased. So this basically said, how many customers can you have at your store at any given time, et cetera, et cetera. Again, some provinces entered this phase 2, some do not. Again, you see that those that entered substantially recovered over that. Phase 3 was actually a different type of easing. So before, we are reopening particular part of the economy, reopening small, medium retail, reopening large retail and malls. Here we are loosening, we are keeping businesses open, but we're just loosening capacity restrictions overall. So we are allowing more people to be in the same shops at the same time. That does not have such a clear effect as we've just seen. Right? Now, there's a number, this is basically raw data, so there's a number of questions that came up in terms of, you know, does this reflect provincial heterogeneity, the fact that the switchers are just different from the stayers, which we can think about fixed effects at the province level. You can think about, does this reflect just common patterns that are driving, we can do day fixed effects? Or more likely, what is the basic exogeneity issue here is that selection into easing reflects, at least in part, disease incidence at the province level. So what we're going to do here is essentially turn into a panel fixed effects version of what we just saw, and try to tease out this while controlling for fixed effects and disease incidence. Now, there's a lot of numbers on this table. I want you to focus on, let's focus on the simplest possible number. All right. So this basically tells you, let's focus on province 5. So I'm regressing on my left-hand side is the daily year-on-year expenditure growth at the province level. On my right-hand side are a series of dummies, which is a dummy that takes a place to a value 1 in date t if the province is into phase 1 at that period. The same for phase 2, the same for phase 3. Notice that I'm controlling for province fixed effects and day fixed effects. So common variation, nationally imposed policies like phase 0, the lockdown, do not come into play here. So the omitted category is exactly the last national homogeneous policy facing the different provinces, which is phase 0. So what is this telling you is the differential effect of switching into phase 1 relative to provinces that say in phase 0 gives you a 10 percentage point increase or 11 percentage point increase in expenditure growth. As you switch, you can then see what happens in phase 2. So phase 2 relative to the provinces that remain at more restricted levels has a higher growth, percentage point increase upon easing of those restrictions. Phase 3 is obviously better than remaining at phase 0, but you see from here that, as was suggested by those graphs, there's no differential effect between these two. So one take-home point is that this suggests, if you take this at face value, it suggests a more nuanced view of the cost of lockdown and suggests that outright business closures and sectoral-based policies seem to impose a much bigger cost in terms of expenditure growth than capacity restrictions conditional on remaining open. Right? And that might be of use as we enter into possibly new phases of this disease in the future. What you see throughout is we've also controlled for daily COVID incidence at the province level. So for example, in column 6, we do exactly the same regression setup with fixed effects that I've told you before, but we additionally control for daily COVID incidence as measured as new cases per capita, or actually per 1,000 inhabitants here at the province level. That is, in most of our specifications, that has conditional on being in a phase, on the same phase, provinces with differential COVID incidence do have different consumption implications. In particular, the larger the incidence, the lower your expenditure growth, conditional on the phase of easing that you are. But that is actually, that is there in the data, but does not survive on our very last regression, where we include fixed effects at both day and time. Right, so that is exploring the dynamics of the data and going from the global to the province level, which allows you to start running this type of experiments and asking questions. Now, if you remember, let's step back. We wanted to think about this as a granular consumption survey as well. So we are first going to go over a validation exercise, and then we're going to apply it again to COVID-19. So what is going back into validation, so we've tried to match, we have these Bbva expenditure shares by narrow categories. And on the other side, we have an official household consumption survey for Spain. The first thing that I've already told you about is that about 34% of the Spanish consumption basket, and this is a big typo, this should say does not appear in card data. I apologize for that, right? And we've talked a little bit about what are categories of consumption that do not appear in card data. Having said that, we are able to match about 50% of total consumption at these narrowly defined categories. And within those categories that we can match, if you form the consumption aggregate and then form shares of those categories, we have a very high correlation of about 0.87, right? So the consumption portfolio or consumption allocations of households in Spain and in Bbva coincide whenever you look at the corresponding categories that can be matched across both. We also discussed in the paper that not only is this true in aggregate, but it's also true when you start thinking about household covariates and how consumption shares vary across household covariates. And one particular household covariate that we're going to be using throughout is income, try to relate consumption and income. Now, we do not link this data into account level data, so we do not know individual consumption. But as I told you, we know both the place of residence of Bbva cardholders, we know their postal code, and we know from national accounts the income per capita in that postal code. So we're going to use that as an income proxy. So what you have here is a high correlation of consumption shares. What will we find when we do that? We can do in the national survey and in the Bbva expenditure data, the shares of consumption expenditures across categories by income group. And we find a very high correlation. And we find intuitive things like, for example, relatively poorer households spend more on groceries than richer ones, relatively more in terms of shares. They spend less on total dining, right? Total dining is a big consumption share, consumption category for the rich, but not for the poor. And this is true both in the Bbva card data and the official consumption survey. You can go more deep into these kind of narrow categories that we have, and we basically have the consumption life of the rich and the consumption life of the poor as told by the Bbva data. So what do the rich do? The rich take taxis, they go to gyms, they go to massages, beauties, and hairdressers, they go out and have fun. They use time-saving technologies like just pay parking instead of going around the block trying to find a spot. They travel, and they spend a lot of leisure time. What do the low income do? The low income spend on necessities, okay? And on tobacco, which as a smoker, I can relate to. All right, so once we have these consumption shares and we've kind of validated, they make sense in data, what happened during the COVID crisis? So again, remember in Spain, March 15th, and then easing in early May. This is the dynamics of expenditure shares in the data. So what is happening? A very large reallocation of consumption. Not surprisingly, it's a reallocation towards necessities, in particular food, that takes a much larger consumption share during the crisis, at the expense of stuff like traveling, stuff like furnishing your house, or fashion expenditures, right? So again, there is these social goods or luxuries that all disappear during the crisis, or all but disappear during the crisis, and the increase of key necessities like food and health and other services in which there's a lot of, for example, paying for IT, paying for access to internet, etc., which you can see as a necessity during the crisis. Now you can go a little bit deeper, and you can think about which ones are the very narrow categories that are increasing the most throughout lockdown, and they are small corner shops selling food. Everyone is smoking quite a bit. Everyone is paying credit into their mobile phones. Everyone is buying food in other retailers, etc., etc. What are people not doing? Fashion, socializing, decorating, and doing massages, obviously, which has one-to-one contact. The other point that you want to observe is that by late June, I mean, this reallocation is basically back to normal. So the sectors that grew a lot during lockdown have now gone back to their pre-lockdown average. Okay. The final thing I want you to notice that is already evident from here is that the sectors that declined the most, the commodities where expenditure declined the most, are also social and luxury goods, right? So that takes me into the second point we want to make here, which is we have seen that rich people consume relatively more social and luxury goods. Right? So there's some more aspects of conspicuous consumption on the richer side of the spectrum. And we've seen that those goods are exactly the ones that fell during the crisis. What does that imply? That implies that expenditure across income groups was differentially affected during the crisis. In particular, the rich groups' expenditure falls by more in absolute and relative terms. How do we do this? Remember, our income proxy is Madrid postal codes. So this is the average expenditure and levels of the richest Madrid postal codes. And this is in growth rates. So what you see is a very large decline in the richest groups, a decline throughout, but a reallocation of consumption into away from the rich and into the poor. Right. So this is what I was saying at the beginning of the talk. Everyone looks more like a poor person, both in terms of the consumption bundle and in terms of the consumption levels. And you see the same story here in terms of growth rates. The quintiles 2, 3, and 4 actually behave very similarly during the crisis. Their year-on-year decline of consumption is very similar. The one outlying observation is the richer group, for which expenditure declines by more. Final point, witness the very large and very fast recovery across all income categories, in particular the rich, upon ease of lockdown, upon when Madrid entering phase 1, as we drew here. We can again take back this into a formal regression analysis. And again, let's just focus on the more demanding specifications where we both confirm for control for disease incidence at the zip code level, at the postal code level in Madrid per day, and control for day fixed effects and zip code fixed effects. What do we find? What is the omitted category, first of all? The behavior of the poorest zip codes or the poorest groups in Madrid after the lockdown in terms of their expenditure growth. So what this is saying is there is no statistical difference in the patterns of expenditure growth from the poor to the middle class. Upper middle class and rich declined saw their expenditure decline by more. This is consistent with other findings in the literature. And what does this lead to? This leads to an increase in savings by the rich, which we start to be seeing in the national accounts. But again, we don't do this here because we're not linking to account data itself. Last point I want to make, we can use transaction data as a real-time mobility proxy, okay? Now, in many countries, Google and other vendors have actually made available very granular across space mobility series. This is not the case in space. You have pretty aggregated at regional levels, not even province levels. But what we want to do here is we want to think whether the transaction data can help us think about mobility. Now, mobility is a big thing in general. It's basically the spatial patterns of trade, but it has been key during this crisis. And this is so because of the tight link between mobility and epidemiology, right? And diffusion of disease, right? So all of the policies we've taken are basically restricting mobility. So we're first going to do two things. We're going to compute from the Bbva data the national spending on transport category, right? So this is in the aggregate in Spain. Total expenditures in buses, trains, urban transport, gasoline to go into the car, parking, tolls, and taxes. That aggregate of transport expenditures, we're going to calculate growth rates. And to be able to compare with Google Mobility, we're comparing growth rates relative to pre-crisis levels. So this is not the same year-on-year growth rates. This is to be comparable with Google Mobility in blue. So this is basically telling you two things. One is that our expenditure-based index on transportation categories declines abruptly. That's not surprisingly. And tracks Google Mobility series pretty well, particularly up until early May. And lending further credibility, you see this very strong weekly seasonality. People are spending less on weekends even throughout the crisis on transportation. Let's move a little bit. Now that we can do this, we're going to zoom in even further, and we're going to do total expenditure growth during the crisis relative to pre-COVID averages by income group. So we're going to go back to these Madrid zip codes, and we're going to compare how much expenditure on transportation has fallen for the rich and for the poor. This is the decline of expenditure for the rich. This is the decline in expenditure for the poor. So what you see is very large differences between these two groups. And they seem to be related with work-related expenses, as the expenditures for go on a weekly pattern, right? So you go to work Monday to Friday and you don't go to work on the weekend. And I'm finishing now. So one last point that we want to make is we can go into the narrow urban transportation categories, right? That make up this index that we've just formed from expenditure data, and ask what happened during lockdown. And there's a lot going on here, so I'll just give you the take-home message, which is during lockdown, there's number one, an overall shift towards private transportation and cars. That's not very surprising. You're trying to avoid being stuck with other people in public transportation. But the richer groups are able to cut much more their spend share on urban transport, which we take as commuting patterns within Madrid to work, than the poorer groups. Meaning the poorer group spend share on urban transportation, on commuting to work, is much less changed during COVID. That, together with this, tells you that the poor are more likely to remain working. And this is consistent with other studies in the literature of saying that, looking at occupation and saying that occupations that were amenable to telecommuting tend to be correlated with high income, while the ones where to keep working, you need to keep going physically to work, are correlated with low income. And that is exactly what we're seeing. Final application, we want to think about this urban transportation narrow category as a predictor of disease incidence. So what are we going to do? What is the story here? We're going to look at disease incidence at the daily level within each of these Madrid zip codes. And we're going to do a Poisson, this is a count variable, so we're going to do a Poisson panel model, where we're going to control for Black daily incidence, because this is a persistent effect. We're going to control for lockdown fixed effects and postal code fixed effects. And we're going to look, the variable of interest here is how much did urban transportation expenditure decline 2 weeks to a month ago? And this is precisely to account for COVID-19's incubation period, somewhere around 2 to 3 weeks. So what we're saying is, in postal codes where expenditure in urban transport declined the most, daily incidence, future daily incidence 2 weeks ahead also declines the most, right? So we are basically linking the transaction data, and particularly urban transportation expenditures, into epidemiological, differential epidemiological outcomes at the zip code level. Now, the final thing is, we know the zip code level correlates with income, can be taken as an income proxy. So you can do the following counterfactual. You can take this regression and say, what would happen if everyone else had adjusted urban transportation expenditures like the rich did? So what would happen if everyone was able to comfortably work from home rather than get on the Madrid subway to get to work? What would happen to disease incidence? And this is what would have happened. So the poorest postal codes in Madrid would have a 5% reduction in COVID cases had they been able to substitute away from urban transportation and transportation in general, more or less. Further, this is near monotonic in income. Right? So this is basically telling you that from transaction data as a mobility proxy, you can tease out how the differential effects of the health status by income and track it down to the fact that the poorest in society had to keep on commuting to work. And that had a non-negligible, it's not huge, but it's not negligible impact on disease incidence of the poor versus the rich, which is germane to discussions going on in the UK to why BAME groups have been more affected. All right, so I'm going to stop here. I want to say a couple of things. So we validated our data, and I think the unique findings with respect to the COVID literature are the following. We kind of leave behind this a little bit naive, 0-1, what are the lockdown costs, should we do lockdowns or not? And we're basically looking at marginal lockdowns or successive easing of lockdowns, successfully less restrictive lockdowns. And we are using this timing variation across Spanish provinces to control, and while controlling for disease incidence, and concluding that this outright sector and business closures are more costly in terms of expenditure than just capacity constraints. And this suggests that, from the point of view of economics, you would try to do social distancing through these capacity constraints rather than outright closures. So in that world, stuff like rotational work adjustment schemes, part-time work would become much more front and center in the discussion, rather than let's just shut down retail or shut down large retail, which, as we saw, has large effects. Finally, we think we're also pretty struck by this possibility of going from essentially transaction data all the way to documenting differential disease burden across socioeconomic status through their transportation pattern. And I'll stop here. I don't know if Rebecca wants to come in. Rebecca, are you there?
Hello, yes. Thank you very much, Vasco. That was absolutely fantastic. Obviously an incredibly rich and useful data source with many applications and yielding many insights. And I was just wondering, before we just take a couple of questions from the audience, you mentioned that at the beginning of your talk that these data are widely available. I think you talked about a deluge of data being widely available. And at the same time, it's not clear that they are being widely used by statistical agencies. So I was wondering whether you could say a bit about how you've accessed the data and worked with these data and any restrictions you've run into. And then after that, we'll take a question from Anthony Savagar and from Craig McLaren.
After 3 months, I still have this crazy thing about the mute and unmute. So by widely available, we mean they exist, all right, which is already something relative to non-existent official statistics, say at the zip code daily level per category of consumption and income group, right? And they are collated every day in almost every country in the world. It's there. Now, there's a question of access, and there are very obvious restrictions to access, very obvious, concerns about privacy. Our particular experience is, I think we got lucky. We are facing a bank that has a research department that is interested and sees the value in this. More generally, I understand and know that private banks, financial apps also, so smaller data sets, are collaborating and sharing their data with governments and statistical institutes worldwide. And I think the challenge here is really to find ways in which we have a normalized access to that, right? So for example, can the ONS strike deals, strike agreements with the many lawyers of these institutions such that this data is available to researchers in a properly anonymized way? For example, our experience suggests that we never see the actual data. We send queries to Madrid, and that leaves us much at ease because we never see individual level data. We get cuts of the data and aggregates, and many times we just get results from the cluster in Madrid. So I think it's a challenge, but I think it is there. It is very valuable, and the flurry of papers on transaction data from financial apps in particular, but also large-scale transaction data such as ours, tells you that it is not impossible to do it, and that it is incumbent upon statistical offices to try to, given the value of this data that we hope we've shown, how to normalize and make that access more official, I think is a big. It's a challenge, but it also holds a lot of opportunity. And the fact is, people like me already have it. So it's the normalizing access and thinking through these things is work, but does not seem impossible.
Thank you very much, Vasco. And now we'll take a question from Anthony Savagar.
Hey, can you hear me, Rebecca?
Yes, yes.
Hi,
great.
Anthony. How's life?
Yeah, hi, Vasco. Thanks for your presentation. Very interesting. So, Anthony Savagar, University of Kent. It was just a clarification, really, that came to mind when you were showing the correlations between region and at the very near the start.
Yep.
To do with region and the income of the income of the region and how much they'd been affected in terms of consumption. I wonder to what extent the online versus offline transaction tagging is important. So I guess if it's online, it's going to be tagged in the location of sort of production rather than the location where the consumers consuming the product.
Yes, there's a lot of decisions feeding into each of these things. I think Sevi and Stephen are on the call. I don't know if they can come in, but I believe this data is done on offline expenditure alone.
Okay.
These correlations, we can always separate these two out. In a lot of points in our paper, such as these, like when you want to know, where an expenditure takes place at the province level, or the residents of who are the residents of which postal code are expending, we typically we can do this with and without. The correlations are high throughout, but yes, online transactions are basically centered around certain postcodes, which is where the virtual point of sale is located.
Thanks very much. Yeah,
we have some work in the appendix relating also just separating out online expenditure behavior.
I guess
the one-liner there is there is substitution away from offline into offline. So it offers an avenue for substitution, but it does not look like a permanent one. So as Spain normalizes, the online expenditure declines back to previous levels, which suggests that this is not a watershed moment where brick and mortar is going to disappear, at least in Spain.
Thanks very much.
Okay, I think we'd like to take a question from Raymond Lydon from the Central Bank of Ireland.
Hi, that's a great presentation. Thank you. What about trends away from cash during the crisis because of fears of the virus itself? So we've seen that a lot in Ireland. So our card sending looks a bit like yours, not as close to pre-crisis levels, but we think that some of that is shifts away from cash. So a lot of shops just have a sign when you go in, we won't take cash, you must pay by card or mobile. So any thoughts on that and how that might be affecting some of the trend analysis?
So I think that's a big question. I don't think we have a great answer for you right now. We have the hope of getting the answer because in our data, we see not only actual transactions, but we also see how much money you take out of an ATM. So if that's your source of cash, we are excluding that category in most of our I think in all of our computations that we've shown you. But if we can work with that, and yes, I think there is substitution away from cash. What that tells you is, for example, on the aggregate patterns, that the decline is larger than what we document, the aggregate decline, right? Because you are looking at the part that, so there's an extra kick in of cash transactions also disappearing. But I think that is a big thing that we hope to kind of at least document a little bit more coming.
Yeah, that's what I would have thought. Thank you. Thanks.
Okay. Well, thank you very much. I think that's all we have time for on this occasion. So thank you very much, Vasco, for an absolutely fantastic talk. Really interesting to see what can be done with these data, and I'm sure they'll find many uses. Thanks for everybody for participating. I hope you'll be able to join us again in 2 weeks' time when we'll have Juan Mateus Garcia from Innovation Foundation Nesta joining us, and he'll be talking about measuring the economic impact of COVID-19 using business website data. So I hope to see you then. Vasco, thanks again for your talk.
Thank you so much, Rebecca, and thank you to ESCoE and the great work you've done. Obviously, this is very relevant, and if ESCoE can help pushing for exactly these type of things to appear in the public discourse, I think that's a great service.
Thank you.